Hello, everyone. I'm Becca, dietitian by trade, mom 24/7, wife from the start, and when there's a few extra hours in the day, you might find me hitting the trails or on horseback.
And I'm Kara, a therapist to women, a mom to a boy, an entrepreneur, mountain junkie, and a postpartum runner.
And this is Fit for a Queen, a podcast that's devoted to the female athlete wanting to balance the teeter-totter of all the things we desire out of life as women: performance, health, intellect, and taking time for self, even if we only get 1 minute out of the day.
We're so excited to be bringing you the queens in the athletic world who have done just that. Okay, ladies, take a seat at your thrones, grab your crowns, and welcome to Fit for a Queen.
Well, welcome back, Queens. Today we have Michelle Cordero. She is a certified athletic trainer and corrective exercise specialist in Miami, Florida. She was mentored by leading experts in heat illness in the United States while pursuing her degree at University of Connecticut, as well as learned from top educators in the field. She then went on to pursue her master's degree in sports medicine at Florida International University, where she began her medical coverage with young athletes in the high school setting.
She has a passion for sports and love nothing more than to help athletes overcome their struggles and get back to competition. Michelle has been the head athletic trainer for the 5-time state champion and 2-time Dick's National Champion girls basketball team in Florida, has worked with elite level athletes in the U18 and U20 women's national soccer team. Although her primary practice has been working with student athletes in middle and high school, Michelle has also worked with collegiate, professional, and high-level athletes in multiple sports, as well as been part of the medical staff with the FC Barcelona Escola, an international academy based in Barcelona, Spain that holds soccer camps worldwide.
She's the creator of Athlete Remedy, a website devoted to empowering and educating sport parents and athletes with practical tips and guidelines for preventing, treating, and recovering from sports injuries in a language that you can understand. She strongly believes in providing a user-friendly approach that cuts to the chase and isn't full of big scientific explanations. So welcome, Michelle.
Thank you so much for having me. It's a pleasure to be here.
Oh, great. So how's the weather treating you in Florida?
It's pretty good. Typically here it is hot and humid, but I learned very, very quickly, or I was reminded of while I was in school in Connecticut, that I will never complain of the heat. I'm a tropical girl,
Yeah.
And I think ultimately I'd rather have that than deal with lots of snow. So far, so good.
Or like in the Midwest, where one day it could be 30 degrees and 2 days later 90. It's kind of hard to acclimate.
Mm-hmm.
That's tough. Here, I basically have to worry about the weather changes quickly, and we'll get a lightning or thunderstorm that'll come through for about an hour or two. You'd think the world is going to end, and then it clears right up, and it's like nothing happened, and back to the heat. So that's the majority of the weather change here.
So, Michelle, I would love to just start out with I think there's a lot of miscommunication as to what an athletic trainer is and does. So I'd love for you to clarify the role that you have with your athletes as a certified athletic trainer.
I absolutely agree. And the problem is because the name itself, I believe, athletic trainer, is pretty misleading. I typically tell people that I am in sports medicine and then kind of work my way back. Mm-hmm. So although the name suggests that I would train an athlete, a certified athletic trainer is actually a healthcare professional, and we are trained in dealing with emergency situations as well as injury prevention, treatment, and rehabilitation. So in other words, we are the ones that run out on the field or court when someone gets hurt. And we are trained to basically handle, I would say, pretty much anything. So from your regular ankle sprain to, life-threatening injury or head injury on the field, it kind of is all-encompassing. So we work one-on-one with athletes. And I would say a lot of our work is really behind the scenes, which is why I think unless you are a coach or an athlete yourself, you won't necessarily know of what an athletic trainer is. So typically for me, like I said, I am there. We are the eyes that are on the field or court during any sporting event. We run out if something happens. So we are typically there when an injury does occur. But aside from that, we also work, like I said, behind the scenes. So identifying any like predisposing, conditions that, an athlete may have, particularly a student athlete, which is who I work with, and identifying and doing things to prevent an injury from happening. We do a lot of, we do taping, we do bracing, we do exercises to help kind of like correct any of these movements that kind of predispose them to an injury. And if they do get injured, we're the ones that are there working with them day in, day out, getting them back to health and back to the field.
Yeah, I remember one time being at a conference and Dr. Mitch Abrams said athletic trainers are the bartenders of the sports world. They see all, they hear all, and they know all.
That's very cool. I've never heard it that way. That's I'm going to use that.
Go for it. So what made you decide to be an athletic trainer?
It's interesting. I did sports all of my life, since as long as I can remember. I did everything from like ballet, dancing, and basketball. I played with the boys. I remember vividly one of my first memories of being involved in sports. I was about 4 years old, and I played basketball with the boys. And it was never, back then it was not as common to have so many girls participating in organized sports. So, I did it. You name it. Tennis, volleyball, I ran. I was a very, very active kid, and I played multiple sports in high school. And I remember, towards the end of high school thinking, what am I going to do with my life? I had no idea. And somebody that I admired, that was actually a coach of mine, told me, think of something that you would love to do every single day that, you would want to be involved with. And I just kind of began this search, and I was like, well, if I can combine my love of sports with like helping people, that would be really cool. And I did not even know that athletic training existed. I actually started on a path of like physical therapy, which is very similar. So physical therapists typically work sort of on the latter end, meaning they're usually not there when an injury occurs, as opposed to an athletic trainer, right? And so they're very specialized in rehabilitation. And so that's sort of where I started my journey. And while I was in college, I discovered that, I could further specialize in working solely with athletes and kind of being in the action. And that's how I discovered athletic training, and I was all in. I loved it. It was very, very hard, but I loved it. I loved being on the field, being like, right in the action, and getting to learn these skills and helping, athletes when they're hurt.
Seems like it's been a natural fit for you.
Yeah, it definitely has. I remember, it's funny because anybody who's been in this profession, you know kind of the grunt work that has to go with it while you're in college. And my first rotation was with the football team, and this is Division I football team. We had 100 guys, and you're learning as you go. But what I really loved about athletic training is that you would be in the classroom taking class, learning these skills, and then right away you'd be at practice and you'd be practicing those skills. So very quickly you would discover, first of all, if you were cut out for that, and secondly, it was an incredible learning environment because you had to actually immediately apply what you just learned. And I discovered that that's where I'm at my best. And so it really became sort of the groundwork where it really helped me kind of like hone my skills. And I attribute sort of like all of that to my success.
Mm-hmm. Great. Yeah, well, let's talk a little bit about your expertise in sports injuries.
Mm-hmm.
What are the most common sport injuries you're seeing in females? I know ACL injuries are what gets a lot of the attention and discussion around with females. Mm-hmm. I'm assuming you're seeing that. And then what other things are common?
Definitely ACL. unfortunately, because of our anatomy as females, we have a predisposition to a certain degree for that. And, however, it is interesting to see that there has been a lot of research and a lot of different programs developed to be able to prevent that. So I try to stress that a lot with my female athletes. So aside from ACLs, believe it or not, I've seen concussions. I know that's another trending topic, unfortunately, right now. Unfortunately and fortunately, right now that I'm seeing. Also, stress fractures and shin splints, and of course, your ankle sprains are, I would say, probably like the most common injury I would see across the board.
Mm-hmm. What are some things that are putting females at risk for some of those aspects, some of those injuries?
I think, aside from like ACL, due to the anatomy, like I said, that is different from males for that predisposition, I think honestly, I see it across the board, but both, females and males. I think part of it in some aspects, for example, like with stress fractures or shin splints, for example, I had a runner on my cross country team a few weeks ago, very competitive, and kind of did too much too soon, and developed a hairline fracture. And I think with those in particular, you see a lot of female runners specifically that aren't necessarily eating adequately. And so it affects, the bone structure. I mean, obviously, hormonally, depending on their age, there's a lot happening in the body where, you need to eat certain nutrients to make sure that you are actually, at this optimal level, with girls getting their periods and then that changing the body and then different deficits and things like that. I think those contribute. There's not really as much of an education, I think, in that part, right? So there's a stress on training, but nobody talks about that. And so I see sort of a correlation with that. And so I try to sort of add to that and make it part of the conversation.
Yeah, we're big fans of discussing the need to fuel your body around here. So
absolutely. I think, and it's something that I've been doing more and more, bringing the nutrition aspect. And I think it gets so neglected. It's almost like people put it in different compartments and don't ever think about, looking at it as a whole. Right. So for example, somebody will be, will have an ankle injury, and because that changes the way they walk, now they're compensating. They don't realize it. Right. And their knee starts to hurt, or they're having hip pain or like lower back pain on the other side. And it's almost like, I don't understand. Why is my leg, was my shin hurting? It's just my ankle. And it's like people like separate, and it's like, you know what? Let's treat this as a whole body, as a holistic view. And a lot of times, again, people don't think about when they have an injury, they don't think about what they're eating. So I think it is so, so important because we need extra help, extra nutrients, Please don't just think that you need to just, take some ibuprofen to get rid of your swelling and ice, and that's it. There's other things that we need to be doing, ingesting certain nutrients that are going to help promote healing. And so I try to bring that holistic approach, and it's sort of, that's part of the education that I'm trying to do. Sort of say, hey, this matters, and this is why, and this is, in a very simple way, this is what you can do about it. And so that's sort of like been my goal.
Good. Well, let's talk a little bit more again on preventing some of the injuries you're seeing. With the ACL injuries, you talked a little bit more of prevention efforts. Have you noticed a drop in ACL injuries for females? I would say personally, I have. I've had years where I have had nobody, suffer an ACL injury, and then there's been years where there's one or two. I will say, however, with my experience, I've had the ACL injuries I've had probably in the last 4 years with my athletes in particular have been
mainly due to trauma. So one comes to mind, she's a soccer player and she actually got tackled from behind. And so that caused her injury. So it was not something that was, biomechanical. She didn't plant, or she wasn't, her knee didn't give out. And it was not a non-contact injury. So, as far as the trend, I would say it's gone down a bit on my end of things, at least. And I think we attribute that to a lot more education with our coaches and our training staff, so that not only on our side of things with injury prevention, but on their side, because they're training, they're doing these different drills to get ready for their sport. If we educate the coaches and say, hey, let's sort of modify these exercises, or let's add this into the routine, we're doing it in a way where now we are creating new habits, and we're making sure that we identify kids that have, poor mechanics, when they're moving. And so if you start to identify those and correct those, then you know what? Now they're going to start to train properly. With youth sports growing as they are right now so rapidly, and so many different, training programs that are available to everybody, I think, although I think it's a good thing, I think it's also important to emphasize the portion of good movement, right? I mean, I see kids and coaches all the time worried more about the quantity of training as opposed to the quality of training.
Right.
And I think, so what I'm trying to do in a certain respect is sort of, shine a light on that part of it, and it's sort of that detail work, as I like to call it, that makes such a big difference, right? So but I can't be there for every single training session, with absolutely every single athlete, right? And so I'm thinking, okay, so how can I clone myself, so to speak, right? Well, if I speak to the athlete itself, themselves, or their parent, or their coach, or all of them, and explain to them in an easy way where they can understand why this matters and what to look at, now all of a sudden, oh, okay, now they understand, now they know what to look for, and they can correct that, and at scale, that becomes now a better change. Does that make sense?
Yeah.
Absolutely.
Yeah.
I had this conversation with my physical therapist. We've discussed in young athletes. So let's say a runner you see has poor form. However, they're running really well. Do you train them to run a different way? So you would say, yes, absolutely. In the long run, that might be beneficial, even though they're performing really well.
Well, that's a tricky spot because
we didn't have an answer.
Yeah, it's like nobody wants to say one or the other, right? Yeah. Because you have an elite runner or somebody who like you said is performing well. You have a basketball player who has kind of sketchy, shooting mechanics, but they're the star player. I mean, are you going to step in there and be like, hey, yeah, we need to change the way you shoot?
Yeah.
It's tricky. And it's funny. I remember years ago, I was at a workshop getting continuing education. And that was actually something that they brought up. They mentioned the speaker there was mentioning this basketball player back in the day, John Stockton. He played for the Utah Jazz.
Shorty shorts.
Yep, shorty shorts. We love the 90s. I vividly remember I was a big Chicago Bulls fan. Of course, this is Michael Jordan and versus the Utah Jazz and Karl Malone, and so I vividly remember watching this when I was young. And so
defense.
He mentioned that he actually at some point in his career had a torn ACL. And he didn't get surgery. He wasn't out. He continued to play. And I was my jaw dropped. And what he was speaking about, now this is a slightly different, situation. Yeah. However, the way they approached it was, he was performing well. Right. And so that's kind of the point where I'm getting at. What they did was they worked again behind the scenes to kind of analyze the movement and make sure that the movements that he needed to do, or the musculature that he needed to strengthen so that, in his movement, there was no injury. That's what they worked on. Yeah. So they didn't say, oh, that's it. you got to shut it down. We got to do this. Now, I'm not saying, please, by any means, that means that, oh, someone tears their ACL, they can keep playing. That's
Right.
not, the point. However, if somebody is performing well, they're not having, any pain, any injury issues, then I would look at that assessment very differently, and that's kind of a case by case scenario, right? I think a lot of what I try to do is get away from putting things out of context. I think there's with so much information that we have available, there's so many like generalizations, right? Like,
Right.
oh, you have low back pain. Well, you need to stretch your hamstrings because they're probably tight. Like, okay, well, that might be, that might be a cause for somebody, but it's not like the answer, right? And it might not be the exact answer for absolutely everybody to do every single time. And so I guess the answer to that is it's really about, education. It's about understanding what is happening with that particular athlete, with that particular movement. It's looking at the whole thing and then deciding, with the knowledge that you have, okay, what can we do to, minimize risk for injury, correct any movements or details we need to correct, and then make sure that we also, enhance performance, and that in the long run, we are doing what I call, body maintenance, which I teach a lot with my student athletes. They'll come in and they're sore, and I teach them from the very beginning how to maintain their body. If you're an athlete yourself, you're in high school, if you have kids, right? You're a sports mom listening, and you're in this, your kids play travel ball. Every weekend, when they're not in school season, they are out playing travel lacrosse or soccer or baseball. You're committed to this. And so that there are aches and pains and things that happen that aren't injuries, that are just part of the territory. But if you learn about this, what I call body maintenance, right? You learn what to do when you have muscle soreness, what you should do and not do, that's really kind of what I'm all about. And I think there is sort of a gap there in the information, which is what I'm trying to fill, where, we don't just have to talk about, when there's a major injury and you have to go to the hospital and now you have to recover all the way back to health. What about the in between? Your legs are tired because you had, 3 games in a row this weekend, and you have practice on Monday, and you're 14 years old, and you're a baseball player, but you got a soccer game. These are like real scenarios, right?
Yeah.
Right.
And so you go online and you Google, it's like, well, what should I do? Or somebody tells you, oh, go see a chiropractor, or like go get a massage, or, oh, you should ice it. Oh no, don't ice it. Or you should heat it, or you should do this. It's like, those are all great things, but what do you do?
Right.
When, right? And so that's kind of what I'm about. I'm trying to sort of bring context back into all that information so that it's easy, right? I'm all about like not using big scientific words, because it's okay. At the end of the day, you just want to know, all right, my leg hurts. What do I do? I got a game next week. I'm sore. What should I do? Should I ice it or heat it?
So
okay, how long?
Yeah.
I
like how you use the holistic approach, which kind of ties on with our philosophy. So we'd love to know how you balance out performance, health, intellect, and then trying to sneak in time for self.
Absolutely. I think it's huge. And I preach this all day long, because, especially now, there's so many expectations and so many responsibilities, right, and pressures that our student athletes have. Okay. And that's who I deal with every single day. So I always have been a big believer of treating it as a whole, like I said, right? So our bodies, we just have one body, and we need to take care of it. And that doesn't just mean we need to train and be fit and healthy, but there's the other side of it, right? There's the emotional aspect, mentally, the mental aspect of the game is huge, right? And especially when it comes to dealing with an injury or being in recovery. It's funny because I speak to some of my friends and colleagues, and I tell them that, you know what, the majority of my work is really, I just sit there and listen. And it's a lot of, being able to kind of have the confidence again and understanding that this is part of the process, right? So I like to always bring that into the conversation, right? Regardless of if we're dealing with a physical injury, I'm very aware of the effects it has, emotionally, mentally, and I always like to give perspective. I think perspective is very, very important. Looking at sort of the grand scheme of things, taking the scope and kind of bringing it out a little bit, so that you can manage kind of this situation a little bit better. And I think if we start empowering and having these conversations, then we can have a much more positive effect, because we are, like I said, we have one body, but it's, in the world of athletics and performance and life, we are, multidimensional,
Yeah. Well, Michelle, thank you so much for coming on today. I hope you enjoy your day off, and we'll be sure to put all your information on the show notes so they can find you and get some answers.
That would be fantastic. Thank you, ladies, for having me on. And I would love for your listeners to reach out if you are a sports mom, have any questions. I think I provided you with the links. I have a growing online community on Facebook where we do a lot of interactions. I answer questions one-on-one. We do live Q&As and trainings and things like that. I really want to be able to provide value. So please feel free to reach out, contact me, and I'd love to see you in there.
Great. Awesome.
Thanks so much. Mm-hmm. Bye,
all right. Have a great day.
Yep. Bye.
Bye.
Thank you to our sponsor today, Sentimano Counseling. Sentimano Counseling is the premier perinatal mental health practice in Kansas City, treating mood disorders during pregnancy and postpartum, perinatal loss, infertility, eating, and exercise disorders. Go to sentimano.com for further information about the practice and services. For additional information on today's topic and guests, follow us on Facebook, Twitter, and Instagram at Fit for a Queen.
And # Fit for a Queen.
And don't forget to rate us on iTunes. We can't wait for you to join us next time on Fit for a Queen.
Bye, Queens.